The three things that modern healthcare is trending towards is more testing, more treatment, and a higher cost. It's not so much that we're doing more tests, is that the tests that we have now are capturing many, many more people. The tests are becoming more sensitive, which means that same troponin or the ESR or the CRP, these are different types of tests that we do, they're becoming more sensitive. They're being refined in different ways, so they're capturing more people. The problem with that is, even though we're capturing more people, we're essentially creating a bigger pool of potential people that could have disease. But chances are, it might just capture a couple more people who really have disease. That's the thing with screening tests. If I screen you for inflammation with a blood test, I might catch 10 out of 100. If I have a really ultra-sensitive test, now I'm going to capture 20 out of 100. But the reality is still only 8 out of 100 have any real disease. This is a really complex phenomenon in healthcare, and unfortunately, having more sensitive tests does not necessarily mean that your health will be better. On one hand, we're developing more sensitive blood tests and stool tests and saliva tests, but we're also developing algorithms that can read imaging studies better. MRIs, mammograms, ultrasounds. Again, because they're more sensitive, they tend to pick up more on the false positives, which means that you might get a diagnosis that you don't necessarily have. The next one is really treatments. So the medications that we're developing using AI, using incredible technology, is allowing us to build even more sensitive, specifically guided tests, medications that are going to target a particular disease. So diseases that we could never even treat in the past are now maybe amenable to certain treatments because of this technology. The problem is now medications are so hyper-focused that they're really only going to benefit a very small percentage of people. But if the right people take those medicines, their outcomes are going to be so much better. That's the same way for testing. If the right people do those modern tests, modern lab tests, modern imaging studies, they're going to benefit drastically. While at the same time, if the average public just goes and gets more testing done and takes more of these medications, they may not have all the same benefits. Unfortunately, they're just going to have even more side effects. The third one is cost and maybe the way it affects access. So cost and access in healthcare are often, well, we talk about them in the same sentence. So cost of healthcare is going up because these tests are more expensive, because these treatments are more expensive, and the demand for them is higher. Access is also going down because fewer physicians are available for consultations. Some physicians, due to burnout and just leaving full-time practice or practicing less risky medicine, is decreasing the amount of access that patients, such as yourself, might have. When access decreases, demand goes up, and unfortunately, cost can also go up. And of course, this is affected by health insurance and other things as well. So this combination together can make it much more expensive for you to get access. And the kind of access you get may not be the access that you like. Maybe it's virtual and you prefer in person. Maybe you prefer virtual and maybe you prefer in person as virtual in person. Sometimes you prefer to see an MD, but you get a DO. You prefer to see a DO or a naturopathic doctor, but you end up with an MD. Same thing can be said about PA and NP. Now, all of us, I think, offer incredible value in healthcare, but you as a healthcare consumer may not want that. And those are the modern changes that are happening in the healthcare system. I'm going to offer 3 tips on how to maybe protect yourself against some of these changes. Now, protect, I think, is a little bit of an excessive word here, but I think it's important to be a savvy consumer of anything that you use, right? A savvy consumer of healthcare. Do the tests that you for sure will take major action on. If you do a test that may or may not change your actions, I recommend not doing that test for my own patients, not for you. Remember, I'm not giving you medical advice. When it comes to treatments, focus on the treatments that will have major impact on your health. And if it doesn't, if that treatment, if that medication doesn't have a major positive impact on your health, consider a lifestyle change. Consider doing things differently in your overall life and how you do things, how you manage things, your stress, your exercise, your diet, and allow that to give you the ideal health benefit. And finally, when it comes to cost, understand that more and more people are becoming very dependent on health insurance products and healthcare systems. Maybe detach yourself from that a little bit by building some relationships with physicians or physician assistants, nurse practitioners, NPs, NDs, whatever, who are in the cash-based system. You can get incredible care in the cash-based system. You can get MRIs cash, you can get lab tests cash, you can get a physician cash. And building these relationships in cash generally will lower the cost for you. And if nothing else, give you this peace of mind that, all right, at least I have other options. I don't have to depend on my health insurance quite as much. I hope this is helpful. Leave some comments below. What do you agree with? What do you have some doubts about? And check out drashori.com. Take care.